Stereotactic radiation is more advanced radiation that combines intensity modulated radiation. And the key to the intensity modulation is this photo right down here. This is the multi-leaf collimator. And when we do intensity modulation, so if you think of a regular X-ray machine where you can collimate just in length and width, this allows you to make shapes. And what happens is the beam will rotate around the patient, and this shape can change every 2 degrees, allowing us to spread the side effects over more tissue, which doesn't sound intuitively great, but I have a good example I'll give you. And really then also lets us to give a super high dose to the target area. So if you have a cat or cats, think about your cat sitting on your lap or on your chest, right? Their whole weight doesn't bother you. In fact, perhaps is comforting. But when your cat decides to climb onto your lap, perhaps onto your quad after you've done a big hike, and they put, 70% of their weight on one of their teeny little paws, it hurts. So this is what we're doing by spreading the dose over the larger volume is we're radiating more tissue, but each area is getting less, which allows us to limit the side effects. So what we're looking at here is this is the multi-leaf collimator, the shape, and this starts on the bottom of the dog. This is a dog that had multiple metastases from a thyroid tumor, and all these little red areas were areas within the lungs that we were able to target. And you can see, for instance, as it went over the spinal cord, it's blocking that area. It is blocking areas around the lungs. So it literally is moving throughout the course of the treatment and therefore can safely treat things that we never thought we could treat before without causing severe side effects. This is that same dog showing the dose distribution. So over here is the scale. So you can see I pulled the slider up to kind of the red level, and you can see those high doses nicely conformed around all the mets that we targeted. And as I bring the slider down there, we're seeing the lower doses. And, this is in the 7 gray, which the whole lung can take 7 gray, no problem. And we haven't treated, even the whole lung. And so this is a way that we can treat things that really were previously considered untreatable with radiation therapy, which is, to me, just incredibly exciting. And I never get bored of it.